Jaguar 1 to control. Sorry for the delay. Glenn had to take a leak. It was unavoidable. Target area is clear. Repeat, target area confirmed clear.
Dr. Lee, target area is cleared. Launch vehicles in range. All systems go.
Thank you, Caesar. Whenever you're ready. The CT-10's light enough to launch from a UAV, but can penetrate 8 feet of 6,000 PSI concrete before detonation.
Bombs away.
Precision guidance system's not affected by darkness or weather and can hit a 2-foot-wide target from 69,000 feet.
What about sound?
None inbound at all. We've developed a new fan and a baffling
Ordnance
design
on target in 3, 2, 1.
I feel better already.
Need to see a shrink. Seriously.
Well done.
Wendy! Call 911! Dr. House.
Désolé, je parle pas anglais.
I'm a co-worker of Wendy Lee's. I'm also her boyfriend.
Great, and a guy who doesn't care.
She's your patient.
Well, you thought I didn't know who Wendy Lee was? Yeah, that makes sense. I'm not good at names. Did Dr. Fortune tell you that?
Her last boyfriend was a real nut. He's basically stalking her.
See, this is what I don't care about. I don't care who cares about her, who used to care about her. If either one of you falls down dead, you can drop me a note.
I think I know what's wrong with her.
Like you screwed up in the lab and accidentally spilled some bomb on her.
No. He really is crazy.
Poisoned.
Apparently our mad scientist is also a slutty scientist. Whose milkshakes got all the nerds in the yard fighting over her.
She's a slut because she's dated 2 different guys at work.
Oh, I'm sorry. I thought we were still judging her.
She's not a slut, and it's not poison. When we tested her blood and cerebral spinal fluid for toxic exposure, it was negative for every poison we could think of.
Well, that just leaves every poison we didn't think of. She works in a bomb factory.
So do a lot of other not sick people.
If the guy had any actual evidence she was poisoned, he would have gone to the police, not to us.
And if we had any evidence of what was wrong with her, you'd be showing us MRI results. I assume they were negative?
Couldn't hurt to start activated charcoal, see what happens.
You know what else wouldn't hurt? This case is getting interesting. Let's add a little danger.
Looks like she actually was being poisoned, but she's been doing it to herself.
I'm not an alcoholic.
I know. The whole label thing is so limiting. You're a person who happens to suffer from alcoholism.
You broke into my house and now you're being a smartass?
During your history, you said you didn't drink at all.
I don't.
You just collect bottles.
Yes. I collect them for my friend. She uses them in her art projects.
And you're ashamed of these art projects. The bottles were hidden.
This is because my housekeeper keeps throwing them out. I've told her a dozen times not to, but either she doesn't understand or she doesn't care.
Why would she lie?
That's the easy question. She needs a government security clearance for her job.
And what's the hard question?
If she's an alcoholic, why doesn't she have at least some partially full bottles in the house? I mean, why keep the empties? Why not just throw them away?
So she's probably telling the truth.
So what do?
We start her on Valium for alcohol withdrawal. It's the best we've got right now.
Abdominal pain.
She said it felt like she was being stabbed.
Give her morphine, 5 milligrams IV.
Is it a symptom of the underlying condition or a symptom of our treatment?
We'll know soon. I stopped her
We
treatment.
should restart it. Acute pancreatitis from alcoholism would cause this kind of pain.
Stress related.
She's in a lot of pain.
She's under a lot of stress. She's got 2 guys fighting over her, and she just got done with the final test of a new bomb. Her guilt is killing
As
her.
far as you know, she likes being the center of attention and loves her job.
As far as you know, she doesn't drink.
What if it's a kidney infection? Acute pyelonephritis could kill her if we don't start her on IV antibiotics.
Would kill her if it was pyelonephritis, but since her urine and CSF don't show signs of
I
infection.
paged House. What? We got nothing. Less than nothing, since he's actually ignoring my pages, which means we have a sick patient and apparently a sick boss. Underlying neurological condition exacerbated by an acute UTI brought on by her sexual escapades.
Slut escapades. How do we treat a scarlet A?
Sorry, acute UTI brought on by her healthy enjoyment of her womanhood. We start her on IV ampicillin and an aminoglycoside.
She's in VTAC. BP's dropping.
Whatever you're doing isn't working again. There's got to be some way to stop the seizures.
It's not a seizure. She's having a heart attack. No pulse.
That's impossible. She runs marathons.
Charging 200, clear.
Still no pulse.
Charging 300.
Why is this happening?
Clear. got a problem.
AICD not working?
It's the defibrillator. I'll be looking elsewhere. It smells like bleeding.
Rectal?
And vaginal.
We need to treat the underlying condition. Could be cancer, sepsis, trauma, liver disease, hemorrhagic fever.
I'm gonna start treating the symptoms while you finish listing the possible causes. Paige said she's now bleeding from her mouth.
Start treatment?
I said I would.
A yes would have been fine.
Not asking the question would have been even better.
Any breathing issues?
No, but I'm not sure it's internal.
It's coming from both ends, it's internal.
Her gums look like they were burned.
28-year-old woman presenting with burn-like wounds in her mouth and esophagus from a candidiasis infection.
Interesting. It would also be relevant if the woman had had seizures.
Fungus had entered her bloodstream.
You would have seen it in the blood work.
Acute myeloid leukemia can cause swelling in the gums.
Again, interesting, but not relevant.
Again, you're being an ass.
She doesn't have a history of blood diseases in her family, her blood count's normal, and she hasn't been exposed to a chemical toxin.
Not that we know of.
The guy that she works the most closely with is also her boyfriend. You don't think he would have told us if there'd been some sort of chemical spill or accident?
There is one other cause of AML.
Wait, where are you taking her?
We need to get her into an isolation room and prep for a hematopoietic stem cell transplant.
Isolation why?
We think her blood and immune system have been destroyed by an exposure to ionizing radiation.
But we don't work with radiation.
Well, apparently your girlfriend does.
No, she doesn't. You're wrong. It must be something else.
We found reports that your company was developing tactical nuclear warheads for bunker-busting bombs.
Where, on Wikipedia? Some paranoid idiot's blog? I don't care where you read it. It's not true.
You're saying there's absolutely no chance that anyone in your company is doing any experimental research that you don't know about?
No. But I know Wendy and she wouldn't.
Well, maybe you don't know her as well as you thought you did.
Excuse me, we have to go.
Inflammation of the genitals means we were wrong.
Thanks for the statement of the obvious.
You think so, wouldn't you? Foreman wants to keep shooting for radiation poisoning.
Because the seizures have stopped, because her fever's gone away, because she's improved.
By luck.
I don't think the patient cares.
Yes, she's going to die in considerably less discomfort thanks to you treating a few of the symptoms instead of the disease.
Paige,
Shut up.
You can relax.
She's getting better.
Bad news is, because of your extended exposure to her and her workplace, we're going to need to treat you as well.
I feel fine.
Unfortunately, that's the way it can be with radiation. No symptoms until it's too late to do anything.
You're going to need a bone marrow transplant.
No.
A marrow transplant does leave you exposed to all sorts of illnesses, but there really is no choice here.
She doesn't have radiation poisoning.
She's getting better.
We need to start your treatment before it's too late.
No.
You're either suicidal or you know we're wrong. And the only way you can know for sure what wasn't killing her is if you knew what was. And you do, don't you?
Because you've been poisoning her. And the reason she's getting better is because you haven't been near her.
Our co-workers are on their way to your home right now to search for poisons. You mind saving them the trouble?
Attempted murder is better than murder.
Where's Caesar?
In jail. He was trying to kill you. He found out about you and Glenn, which he admitted shouldn't have surprised him since he started seeing you while you were dating Tony.
He poisoned me?
Repeatedly. With Spanish fly. The active ingredient cantharidin is a potent toxin and can cause a lot of the same damage as radiation.
He poisoned me?
I'm sorry.
He had a security clearance.